Evening, I'm Micah Gigido and I will be performing insertion of nasogastric tube to our patient. So, nasogastric tube is a tube that we will insert into our patient's nose down to his or her stomach. So, it is very important that um, we are carefully and successfully insert the tube into our patient because it will help the patient to receive the medicines and the food that he or she will take. So first that we're going to do is we need to wash our hands and observe appropriate infection control procedure. Next that we are going to do is we need to introduce ourselves to our patient, identify our patient, and explain to our patient what are we going to do and why is it necessary. So, magandang gabi po ma'am. Ako po si Micah Gigido. Ako po ang magiging nurse niyo po para sa araw na ito. So ma'am, pwede niyo po bang banggitin po ang pangalan niyo? So ma'am, mag-i-insert lang po tayo ng tube para po doon po natin idadaan po yung mga gamot at yung pagkain po na kailangan niyo pong i-take. Okay lang po? Then after that is we need to provide our patient privacy, such as pulling on the curtains and then closing the door, or we can also put a warm blanket uh, above our patient's chest for comfort. And then we need to gather our equipments, so such as the tube and um, micropore, bandage scissors. And then after that is we need to put our patients into a high Fowler's position or 45-degree angle. So if the hospital doesn't have any equipments such as bed that is reclining, we can make or we can improvise. So we can put two pillows under the patient's head to observe position. After that is we need to check our patient's nostrils so that we can observe or we can see if there is any blockage, um, lesions, or even if the patient's nose has a presence of bleeding. Ma'am, titignan ko lang po yung ilong nyo ha. And then if the patient's nose has any blockage, we can clean our patient's nose with cotton buds, if there is any. Next is we can ask the patient to breathe on the other side of his or her nose to know if the nose or the both nose has a patency of air. So ma'am, tatakpan ko po ito isang ilong nyo. Try nyo po mag-breathe po dito sa kabila. Dito naman po sa kabila. And then, we are going to choose which holes of the nose we are going to insert the tube. So, first is, assuming that this is a nasogastric tube. So, first that we're going to do is we need to measure. So, from the tip of the tube, we need to put this in the tip of the patient's nose. From here. Then, we are going to measure from the tip of the nose to the tip of the earlobe. So here. After that, we need to measure from the tip of the earlobe to the xiphoid process, or um, the last place into the sternum. Once that we measure, we can put here a marker or a tape so that we know that this is the only part that we will insert to our patient's nose. After that, after we put a tape here, we can simply roll this in our hands. And then 1 to 2 inches from the tip of the nasogastric tube, we need to lubricate it so that if we insert this into our patient's nose, there are no hindrances, and also so that the tube can put any danger into our patient's nose, like putting lesions that may cause bleeding. So, we need to insert this into our patient's nose. For example, I have chose the right nose nares of our patient. We will slightly slide gently the tube until the marker, assuming that we have inserted the tube. Once that the patient starts to gag, we can withdraw a little bit of the tube, and then we can also provide our patient to sip a water or any fluids so that it can help the patient from gagging. And also um, we need to know if the patient is all right. So if the patient is all right, after that we can continue, but gently insert again the tube. But if the patient's uh, cough or gagging is persistent, non-stop, um, we can check the patient's mouth using a tongue depressor and a flashlight so that we can see through his or her mouth if the tube is um, successfully inserting into the right place. And then we can also observe if there is any bleeding, and then if um, there is any pulupot of the tube inside the patient's um, mouth or nose. And then after that, when we reach the marker, that's the time where you will stop to insert the tube, because that is the end of where you need to insert. After that, we will going to check the patient's stomach. We need to check if the tube is already inserted into the patient's stomach by auscultating the stomach of our patient. And then we need to flush um, water to the um, asepto syringe. But if there is no asepto syringe available, we can also improvise 10 cc of syringe. And if there is a gurgling sound, that is an implication or indication that the tube is already into the patient's stomach. So after that, we need to secure the tube by putting a tape into the tube, into the nose bridge of our patient. And then that's all. So we can actually insert the medications and the food into our patient's nasogastric tube. We need to oftenly um, change our patients the tape that is holding the tube into our patient's nose, because that can also be a way of spreading of bacteria, and all clamp the end of the nasal gastric tube. And then after that, we need to remove the gloves that we have used and put it into the proper um, trash. And then we need to perform hand hygiene, wash hands. And then after that is we need to dispose the or discard the materials or the equipment that we have used. And then we need to record the time, the date, if there is any lesions, any presence of bleeding, and the color, the consistency of any fluids that is coming out from the patient. And also we need to take down all the reactions and the relevant reactions of the patients while we are doing the procedure. So that is all. Thank you. So we need to check the tube if it is perfectly fit, or if the tube is already into the stomach by auscultating the patient's stomach. And then we need to flush water to the um, aseptic syringe. But if there is no aseptic syringe available, we can also improvise 10 cc of syringe. And if there is a gurgling sound, that is an implication or indication that the tube is already into the patient's stomach. So after that, we need to secure the tube by putting a tape into the tube, into the nose bridge of our patient. And then that's all. So we can actually insert the medications and the food into our patient's nasogastric tube. We need to oftenly um, change our patients the tape that is holding the tube into our patient's nose, because that can also be a way of spreading of bacteria, and also for better and good um, hygiene of our patients while she or he is staying in the hospital. Thank you.